Hi, I'm Dr. B. I'm one of the doctors here at Active Health. I've been in practice here nearly 20 years, but today I want to talk about what we do different when it comes to our assessment here in the office. The good news is we do have a state-of-the-art facility, and we do have the modalities that can heal different, what we go into tissues. Standard chiropractic care, standard physical therapy, things that do not have a multidisciplinary approach. What we've seen in our years of practice is you have to assess the patient the right way. So therefore, you can determine what tissue is affected, right? So obviously, if you have a joint, that has to be treated different than if you have a joint with a disc issue, with muscle weakness or imbalance, with nerve issues. So what we do different in our exam is we look at everything orthopedically, from the chiropractic aspect, neurologically, to see if there's any. Again, it's a big difference if you have a nerve versus a joint issue. So, whether we send you for an x-ray, if that's all you need, whether we do further testing like imaging, like MRI, CT scans. What we do is try to collect all the data. We do work with all the other doctors in town, so we do have a good network of medical doctors. So we are getting all those other things like blood work, and because basically we want to make sure when we do order a treatment plan, we have all the data we need, right? So the key thing is, once all that is together, we come together as a team. We do co-manage with the other doctors, so therefore everybody kind of knows what we're doing. We know what our goals are here. But let's just say you do have an MRI and you do have a disc issue that is pinching the nerve. We will order the right treatment, like a decompression, like a laser. And then once we see those tissues begin to heal, then we can start ordering other things, as you go through the patient experience, like strengthening and all the above. So then, therefore, you can actually get long lasting results. So, again, it starts with a thorough examination, it starts with the right imaging, the right blood work. So, therefore, again, we know exactly what to order and what to do. And therefore, you have an experience, you know what to expect, because you have knowledge and an expectation of what tissues involved, which all have different timelines. So, that's what we do different here.